Hi, Dr. John Sievert here with Medicine.Solutions. Today, what I'd like to do is show you the potpourri of lumbar traction ideas. Many of you have had back pain with leg symptoms and need to do some sort of traction. Traction is a wonderful technique when the evidence tells us in the peer-reviewed literature that you should do traction if you've got back and leg pain. And when you do traction, remember folks, you're at home doing something that's going to help you. Make sure you're doing traction if you've got leg pain, and as you do traction, it's easing the distal pain, the pain farther down your leg, and bringing it up towards your back. That's when it's indicated. That's what the research tells us. So I'll be showing you several ways how to traction using a stick lying between the doorway, using the foam roller to lie on, putting a towel, how we just fold it in thirds and lie that on your sacrum to unload, and lastly, doing ways of lying over a gym ball to unload your spine, or even putting your feet up on the chair. So, without further ado, let me show you a number of ways to do lumbar traction. Probably the best way to do lumbar spine traction is simply lying on the floor with your back flat to the ground and grabbing the stick, a dowel or a broom handle, and putting it between the doorway at waist level. And with it at waist level, I'm pushing into the doorway, creating a nice traction to my low back. If I want to bias that traction towards one leg or the other, I can simply put the other leg on top of the other leg, like crossing my legs while sitting in a chair, and that will stretch the downside leg slightly more. Another simple technique, as you can see, is using a towel, folding it up in thirds, and putting it right on the sacrum, which is below your belt level, and that will create a higher purchase of the sacrum on the floor, and then when you traction, it creates a pull on the low back. Bringing the dowel over your head and putting your body through the doorway, so the doorway is now over your head. A good reason to do this type of lumbar traction is if you had wrist problems, say carpal tunnel syndrome or some sort of a problem where you can't lean or put pressure on the wrists. And as you see from the overhead shot, it's a great way to traction your low back without compressing the wrist structures. A great way to do traction in the 90-90 hip and knee traction position is simply lying on the floor and putting a standard chair next to you. Calf muscles rest on the seat pan of the chair, and in this 90-90 position, this is a great zero gravity position, like many chairs are designed to unload the spine. And get that extra little bit of traction, put your hands on the thighs, push into your thighs, which creates even more unloading of the spine and actually getting a true traction. And here you go, seeing me go on and off and then back on in that repetition of on and off, gently tractioning the back for up to 45 seconds to several minutes. Here's a nice way to do lumbar traction in that same 90-90 hip and knee flexion position as we did on the chair using the gym ball. Simply put your calf muscles resting on the gym ball so that you can rest comfortably without worrying about letting the ball roll from left to right. And then I simply push into the thighs, which creates a lumbar spine traction. Note from above, as I push down, there's a little bit of a gentle sway from left to right to create that little bit of unloading and finding that sweet spot of symptom relief. Lumbar traction in 90-90 position, great, done several times a day, and you'll see good relief from this technique. Here is lumbar spine traction lying prone over a gym ball. simply lay on the gym ball, let your chin rest comfortably on the gym ball, and as you can see, I'm kind of rolling back and forth just to find that sweet spot of unloading the low back over the gym ball where I feel a good stretch. I hold on to it, bring it back and forth, create the relaxation, give it a few minutes, and see what you got. Using the gym ball to do traction in a squatting position looks like this. Simply roll back and forth on the gym ball, where the gym ball is about mid-thoracic spine with the low back kind of dangling underneath you. And as it dangles, I go back and forth, lock the elbows out, push on the upper thighs, and this creates a traction or a pushing the pelvis down towards the floor. And with the back going on the gym ball, then off the gym ball, then pushing down, it's a great way to traction the spine. When doing traction to the low back, sometimes one needs to lie prone over the edge of their bed. As you can see how far forward I am over the bed, and I let my head dangle down, and that creates an incredibly good stretch to the whole spinal canal structures. My hands can be crossed underneath my chest, and then I flex and extend my head to get the spine to stretch. With my legs out straight and just letting my head dangle, lifting it several times to create this continual, nice, slow movement of the dura mater and the spinal canal inside of the spinal vertebral column. So this stretch is wonderful. If it brings on pain, be careful and just do a little bit at a time, but this is a nice stretch to the dura mater inside the spinal canal.